My name is Dr. Gary Barkocy, B-A-R-K-O-C-Y, interventional cardiologist in private practice, and I work at Nacogdoches Medical Center here in Nacogdoches, Texas.
Okay, great, thank you. So my first question is, what are the main objectives of American Heart Health Awareness Month, especially when it comes to women's health?
Well, that's a great question. It's about women and Women's Heart Health Month. You know, we always think of women, we think of things like breast cancer and stuff like that, but we know that women, can get heart disease, and they get it at a later age than men, but they get it and they can be very sick from it. And traditionally, we were very underestimating for what taking care of them. We've gotten much better over the last several years at finding them earlier, detailing their disease process earlier. So we dedicate the entire month of February to a Ladies' Heart Health Month, where we really try to reach out to our ladies and let them know that they can get heart disease as well too.
Right. And so typically, what is that age range for women?
Women get heart disease traditionally about 10 years older than men because their natural hormones and all can protect them. Unless they have diabetes, then it's kind of equal. But in general, ladies get disease about 10 years older. But once they reach menopause, it gets accelerated because they lose their natural estrogen. So their heart disease processes can be accelerated somewhat.
And then that age range for the women, is it usually younger or in older women?
It looks like it's getting younger for ladies. I hate to put an exact number on it, but usually in the 50s and 60s, ladies can start to have more problems, but it's getting to be a younger person's disease, and in men too.
Okay. And so how exactly does it differ from men?
Again, besides the fact that it could be a little later in life, women, interestingly, get very different symptoms. That's probably the biggest concern. They don't always get that classic Hollywood elephant on the chest, problems. Ladies can have anything from fatigue to nausea to just shortness of breath, and that can scare a lot of ladies and can confuse a lot of physicians and all because, typical symptoms aren't always there, and that's the big concern. So for women, it can be very different with the symptomatology, especially.
And so, are there any other specific risk factors for heart disease that are more prevalent in women, and how can women mitigate these risks?
Excellent. They're the same as men for the most part, especially when women catch up to them in age. And it's, so it goes into modifiable and non-modifiable risk factors. Non-modifiable risk factors include age. So as ladies get older, of course, there's more chance. And once they catch up to men, especially. And then your hereditary, your family history and things like that are important. The non-modifiable ones are real important, but also the modifiable ones. So the modifiable ones are things like your cholesterol, your blood pressure, whether or not you smoke is really big deal, and you don't want to smoke as a lady or a man. And modifying all those things, exercising regularly and all, is so very important because those are the things you can fix. So, you might have diabetes, but keeping that diabetes under control is what's most important because that lowers the risks tremendously.
And are there any recent advancements or research findings in the field of women's heart health that are particularly noteworthy or?
We have gotten much more aggressive, and I'm very proud to say, as a physician community, we're getting more aggressive with looking at women. So ladies are coming to us in the heart field earlier, before they're sick. In the old days, they were really sick. And what we're really seeing, which is tremendous, is women in the field and with depression. The big concern is ladies that are depressed, they don't tend to exercise, they don't tend to follow medical management very well. So we're seeing what used to be called broken heart syndrome in ladies. It's become very significant. Even here in East Texas, we've had multiple cases. And it even has a clinical term now called Takotsubo's myocarditis, but it means broken heart syndrome, that women that have gotten so depressed and have had such trauma in their life that they actually get heart sick. So that's something we're being very much aware of and working on, treating and finding early because it can be very treatable and reversible. In general, then, we're just getting more aggressive with our ladies and, knowing that they can have heart disease and contributing their symptoms to heart disease, whether instead of just saying, it's just you and, that kind of thing. Because women are tough. You ladies, you tend to handle symptoms a lot better than our gentlemen do. So.
And so as for the East Texas women, so far from what you have seen, how many women could you say you all have seen?
Well, you know, like most of the country, about 1 in 4 lady deaths right now is cardiovascular. It's heart disease, so it's very prevalent. Okay, and when it comes to cardiovascular disease, it's a mix of concerns. Anything from coronary artery disease, which is your heart attack patient. It can be arrhythmias or extra heartbeats or irregular heartbeats, which is a big deal and needs to be treated in ladies just like it is in men. It can be valvular, you know, congenital problems or problems with the valves in the heart that can cause significant symptoms. And also weak hearts, you know, like we just talked about, heart failure and all is becoming more and more predominant in ladies, and it needs to be treated just as aggressively.
And I guess, how can healthcare providers and communities better support women in recognizing and addressing these?
Excellent. Yeah, great. They really can. You know, our family doctors, our frontliners need to be aware that women get heart disease, and ladies need to be aware. Ladies need to be, you know, cognizant and say when to go see their family doctor and say, hey, these symptoms I'm having, it's not that Hollywood heart attack, but could it be my heart that's acting up and all? And then the family doctors need to know when to send patients to specialists or to do testing and things like that. And I think that's really getting to be very strong in America, which is a blessing.
Are there any other roles stress play in women's heart health, and any strategies on managing this stress effectively?
Stress is very important, probably more so for ladies than men. I don't know that we have, you know, documentation of that, but ladies handle stress so much better. We think it goes back to childbirth or whatever it goes back to, but women are a lot tougher. They're much more stoic, especially here in East Texas. I've seen that. I've been all over the country, and I haven't seen more stoic ladies than right here, and that's important because, you know, they tend to minimize their symptoms. So very often by the time they're seen, they're very sick, and we don't want that. So we really want our ladies to be cognizant of their feelings, talk to their family doctors about that, and certainly if they suffer from things like depression or trauma in their life, to get that, you know, considered strongly, because they can get sick from a heart standpoint, and we don't want that, you know.
And is there anything else you'd like to add that I may not have asked or missed?
Well, I think this is awesome. I mean, you know, for the television station to come to the hospital, you know, Nacogdoches Medical Center does an incredible job at looking at ladies in particular, taking care of the local personalities, and it's important for women to know that locally they don't have to be going to the big city, you know, to be getting taken care of. There's centers here, there's physicians here, there's family doctors, cardiologists that can take care of, you know, the ladies here. This is not something that's rocket science that they have to go to the big city to be taken care of. Everything that can be done right here locally, and we do a very good job with that.